WOCA.
Ocala.
Diamonds in the sunset, now your time has come.
All right, 4 minutes after 11 o'clock. Thank you for tuning in on the phone. Dr. Jayanth G. Rao is going to answer some questions about some important health issues, medical issues. Well, first of all, let me tell you, if I read all of his credentials, we wouldn't have a show. It would be just a list of credentials. It's such a big list. He is a board-certified radiation oncologist. He's the medical director of the Florida Regional Cancer Centers. He introduced state-of-the-art 3D treatment planning, IMRT, and stereotactic radiosurgery to Marion County and Citrus County. He's a researcher for prostate cancer, breast cancer, gynecologic cancer, and it says, oh my goodness, a couple of more things I wanted to make sure I pointed out. He's a member of the Royal College of Physicians, Internal and Geriatric Medicine, and let's see, we are talking today about a few things, including the Florida Regional Cancer Centers in general, which probably is the best way to start, since there are so many different things that you as listeners might have questions about. And that is an important thing to say, because you are welcome and invited to be part of the show. The number to call in is the WOCA Climate Control Source Hotline. As always, it is 352-622-9622, 622-WOCA. Dr. Jayanth Rao, good morning, doctor.
Good morning, Larry.
Thank you. You're in Ocala right now?
That's right.
Okay. Well, thank you for taking time out of your day to answer some important questions about what you do. Can I just ask one from the news?
Sure.
The story about the actress, what's her name, Robin?
Angelina Jolie.
She had her a double mastectomy, but she did not have cancer. What is your thought on that?
Well, Angelina Jolie, like so many others, are just being cautious. There is a genetic testing called BRCA1 and BRCA2. These are special tests that I don't think they're covered by insurance companies, but you have to pay for them. These tests pretty much predict whether or not a person is likely to develop cancer down the road, especially if they have a family history. In the case of Angelina Jolie, she was a carrier of BRCA1, one of them which predicts that she has an 85% chance of developing breast cancer, possibly ovarian cancer, more so breast cancer. For that reason, she was trying to be cautious and underwent a double mastectomy. Once again, remember, even if you do go through the double mastectomy, which may be an overkill sometimes, it does not assure you that you will never, ever develop breast cancer. There's still a small percentage of them who can still develop breast cancer, but in the vast majority, definitely decreases those chances.
Now, if a man had that same test results, would it mean that his prostate would be removed before he had cancer?
You're talking about prostate?
Yeah, I mean, does the same test do the same thing for men, or?
No.
No, okay.
No. This is mainly for breast cancer and ovarian cancers in women.
The research projects that you've been involved in have included prostate as well as breast and other cancers. Do you, in all your work of doing this, do you see light at the end of the tunnel? Is there a day when when you'll be out of a job?
Yeah, I hope so.
Yeah, we don't want to see you out of a job, but
no.
but I mean, is there a day when cancer will be like polio?
Yes. In fact, there are vaccinations being developed right now. It's still not available to us in the community, but research is still going on, just like your polio vaccination. That may be down the road. The emphasis in the future for all types of cancers is not to wait and treat the cancers like we do today, but it's to intervene before the cancer develops. In other words, you manipulate the genes because most of these are caused by a multitude of factors, not just one factor. And if you can manipulate the genes and stop the cancer growth or the tumor from developing, then you've achieved your goal. So that's the ultimate goal, is to prevent cancer and not wait and treat like we do today. So yes, it's many years down the road. In fact, there's another test that that is in the works. I think at Johns Hopkins Institute, I think Stanley Order, one of the primary researcher, has been working on detecting small amounts of cancer in the body by tagging the red blood cells or the white blood cells and leaving them into the body, basically tagging them with a radioactive substance. Right now, we can only visualize on an X-ray like a CT scan or an MRI scan or a PET scan, which has only about 70% sensitivity. It's not 100%. But if you can detect small amounts of cancer, we may be in a better position to cure cancers. So we're still a long way away from that. So there are a lot of things happening simultaneously.
And that's the only way cancer can be detected, because are there no symptoms if a person has cancer?
By the time symptoms develop, and they're vague symptoms, loss of appetite, sometimes nausea, vomiting, just feeling general debility, if you like, by the time they develop, there is quite a bulk of cancer cells brewing in the body. Cancer, it's not just one disease, as some people would like you to believe. It's hundreds, potentially thousands in one in some instances. And it's not caused by one bacteria or the virus that can be flushed or crushed so easily as people will have us believe.
Oh, really?
Yeah, there are growth hormones gone missing, there are genes gone awry, there are so many factors that come into play, and therefore the work that is being carried out currently by premier institutions in the country and across the world are getting together the top scientists working together. Actually, up until now, they were all working on individual things and not communicating with one another. But right now, the money is available from Hollywood and elsewhere, and these people are putting their heads together to come up with the answers. And I think, hopefully, within the next 10 years or so, we should have much better answers than we do today.
Every time somebody has cancer and is getting treatment, they're always getting chemotherapy and radiation therapy. Or at least what I've known, and I don't know really that many people, but I've known a few. Do they get both just because it's better to give them both, or do they work together, or could it be possible that, because chemotherapy is the one that a lot of people say, I don't want that one, I want the radiation therapy. Is there a possible not cure, but treatment of just one of the two?
Sure. Let me take a step back. Chemotherapy is called, it's usually given for systemic disease, usually. That means it's a more advanced stage of the cancer, and that's when chemotherapy is given in general. Of course, there are exceptions to that. Radiation is like surgery. You treat what you see. It's a local treatment. So basically with radiation, you're trying to improve the local control. Say, for example, prostate cancer, which hasn't spread. So you give radiation, you don't need to give chemotherapy. Let's say early stage breast cancer, you don't need to give chemotherapy after the lump is removed, you can just do radiation. But there are certain features that we are trying to understand. Like I said, it's a multitude of things gone wrong. So we are learning more. Our knowledge is an evolution. There are situations where chemotherapy may be needed in early cases too. But in general, no. Early cancers, radiation, and surgery are enough. Now, when they are given together in certain cancers, it's mainly because, take for instance, up until 1970s, a radical mastectomy was done for breast cancer. It was a gruesome operation. The woman feels disfigured, feels lopsided.
Right.
You can never create another breast, when a crater is created, and nobody liked it. So they had to come up with a solution where without the radical mastectomy, something could be done, and still the woman could go about looking, good. So that's where I think they tested the radiation part in the late 70s, along with the removal of the lump. So less of tumor removal, just the lump is removed without removing the whole breast, and that's become the standard of care. Chemotherapy, of course, is given for more advanced cases. Take, for example, rectal cancer or certain gastrointestinal tract cancers. The surgery can be mutilating, and the complication rate after surgery can be horrendous. So therefore, we're trying to find out methods where the quality of life is maintained, and that's where chemotherapy and radiation sometimes take the place of surgery, anal cancer, and they complement each other.
When a woman or a man goes for their annual exam, when the woman goes for their annual exam, their gynecological exam, is she referred to the Florida Regional Cancer Center to have that test done, or is that up to her to go to get that test done?
What generally happens is the patient, man or a woman, in this case it's a gynecological examination, so it's a woman, goes to a primary care doctor complaining of vaginal bleeding or pain in the lower part of the genitalia, if you like, or a discharge or something like that. And if the primary care physician is equipped to do a pap smear, which every woman should have after the age of 20, particularly if she's sexually active, and if 3 pap smears are negative, she can have it once every 3 or 4 years. So first off, they would go to their primary care physician, who would then refer the patient to a gynecologist. In Florida, in Ocala or Citrus County, we don't have a gynecological oncologist. So most of our gynecologists are general gynecologists. They feel comfortable referring them to a major institution for surgery, such as Gainesville, Shands Hospital, or Tampa. So we don't even get to see them unless they're advanced stage, like cervical. I'm seeing one patient tomorrow who has a cervical cancer stage 3 out of 4, which is really advanced. In those instances, you can do the radiation plus chemotherapy in lieu of surgery, which can be quite debilitating.
Dr. Jayanth G. Rao is on the phone. He's here in Ocala, and we are inviting you as listeners to call in and ask questions. It looks like we have somebody on the phone. Let me go to that call. Good morning. Thank you for being patient with us. You're on the air with Dr. Rao.
Yes, good morning, doctor.
Good morning, sir.
Yes, in regards to prostate radiation, can that be done wrecking or destroying the sexual function later on in life?
Yes, it can be to some extent. See, what happens is, in a man at the base of the penis, if you minimize the volume of your treatment with radiation, obviously you can preserve the sexual function to a large extent. Now, when it comes to sexual function, I get asked this question quite frequently. Age in itself in a man is a big deterrent. I mean, the sexual ability decreases as you advance in age. On top of that, I tell the man, if you're sexually active, like once a week or once every 2 weeks, to keep going ahead, not to stop, even during the treatment. That's the beauty of the radiation treatment for prostate cancer. We have a focused radiation called IMRT, or image-guided radiation, which does not damage the bladder and rectum. The incidence of damage today with this new technique is literally less than about 1%. You don't see that anymore like we used to 10 years ago. But regarding sexual function, yes, 30% generally lose their sexual prowess, if you like, with radiation, versus surgery it's about 70% or 75% according to Medicare, testing that they've done on men through questionnaires. So is it zero? No, because there are, again, multiple factors at work. There's the age factor. There's the factor that you don't use it, you lose it. So there's so many other factors. There's psychological factors in play. Some men are afraid to have sex with their wives or girlfriends or whatever during the treatments. So if you take all that into consideration, you can minimize it, definitely. In regards to radiation, I generally ask them before the treatments and after the treatment, and a lot of people do well because we limit the radiation dose to the base of the penis, which is where...
Yeah. If the cancer comes back in the prostate area, can radiation be reused again or used again, let's say in 8 years, 10 years down the road?
It depends on what type of radiation was used in the first instance. I have used it. I've had people come from out of state because I was the only one in the northeast of United States who used what is called high-dose rate radiation, where you put implants. It's like the seeds, but it's temporary. You put implants into the prostate. So let's say that somewhere down in Connecticut or whatever, the gentleman received external beam radiation to the whole of the prostate and recurs 8 years later. And this time around, he will not get external beam radiation. Once again, if there's a recurrence, you can get away by just doing what is called brachytherapy, where you're putting the radiation directly in contact with the tumor, and that in itself can control it. Not everyone does it because they don't have the expertise in doing that, but if you can do that, I think the patient will do well. Yes, most of the surgeons will tell you if you have radiation, you can be treated again, but it's not always true.
Thank
you.
Thank you for the call. And by the way, everybody's invited to call if you have a question for Dr. Rao. Let me ask you about the term you use, brachytherapy. I've got that word in front of me because of the notes to prepare me for this interview. It sounds like you are the guy to go to understand what that is, and you actually treat other physicians, train other physicians?
Yes, I used to hold the international conference on prostate and breast cancer in Orlando, where physicians would fly in from Northeast, and I would also moderate some of the meetings in Long Beach, California for the West Coast. There are a handful of us who started this several years ago, and we wrote the guidelines for the treatment of prostate cancer with high-dose rate brachytherapy. The unfortunate thing, the brachytherapy, by the way, since you asked the word, it's a Greek word. Like most medical terminology, brachy means near, therapia means treatment. So anytime you put the radiation directly in contact with the tumor or close by without damaging any of the normal parts surrounding it, that's called brachytherapy.
Oh, wow, okay.
That's expertise.
Why is it when why is it when cancer is manifested, some people the cancer is self-contained, like in the lungs, and then maybe another person will get cancer around the same time, and that cancer will just be throughout the lymph nodes?
Well, it depends. We're all different, aren't we? As human beings, our protoplasm, our makeup is very different. Some people have no symptoms whatsoever and at presentation itself, they have a very advanced cancer which is spread to the lymph glands, as you said, or through the bloodstream to other body parts. Mm-hmm. And some people are lucky. It's just luck of the draw. They're lucky that it's confined, as far as we know from the investigative tests that we have. And those are the ones who will do better. Especially, this is an important factor that has to be stressed, it's the attitude also that's important. I tell my patients 50% of your cure is based upon your attitude. If you have a positive attitude, you will do well. If you have a negative attitude, you will not do well. Similarly, if you have a supportive family, you will do well. If you do not, you will not do so well. So there are multiple factors that come into play. It's not the treatment.
Wow. Hey, I'm glad you mentioned that because I didn't know if that was kind of myth or not. And the question I had that I was avoiding that I will now ask is this one. Every once in a while you hear a story about somebody who has what they call inoperable cancer, inoperable tumor rather. And then you'll hear like this amazing story that it got smaller, and it's usually a child or a young person. Mm-hmm. And you almost have to wonder, maybe they just were so optimistic about their future that actually had a good effect on a bad thing. Am I too wishful thinking about that?
There are anecdotal reports. All doctors who practice cancer medicine have seen that. We like to use the term miracles, but really it's partly attitude, partly luck, partly there are some cancers that have a tendency to regress somewhat. Sometimes the diagnosis is probably not correct at the first stage.
Uh-huh.
Maybe it's not a cancer. Maybe it's a benign lesion or whatever. So there are so many factors. One has to revisit that and check and see if the original tumor was in fact a cancer.
Oh, okay. So while attitude is important, it seems like what you're saying is that you can't just try to treat it with a good attitude. You can't be cheering yourself up and expect to make cancer go away.
No, you can definitely, do well. I I can tell you anecdotes again
Right.
of a patient who here locally was playing golf, a lady who actually collapsed on the golf course. And her friends took her to the nearest hospital. In this case, it was Citrus Memorial. And she had a stroke on one side. And, you know, the first thing is they called in the doctors from the emergency room to check her out. And sure enough, she had a stroke. And she had multiple small lesions in her brain, which caused the stroke.
Oh, wow.
And here she was 5-10 minutes before playing golf with her buddies. And the next thing is, you know, I got to see her as a third opinion and to treat her to the brain. And they went backwards and they did a CT scan, and the original tumor was in the lung. So it started in the lung, traveled to the brain through the bloodstream. She didn't know about it, or she did not report to anybody if she did have some complaints like headaches or confusional episodes or whatever.
Right.
But to cut a long story short, I saw her, I talked to her, like I generally spend about 80, 90 minutes with the patient explaining things. And the nice thing she said was, we're going to beat this. And I said, that's great. That's the best thing you've said. You didn't say, like most patients do, you're the doctor, you're going to cure me or not cure me. She said, we are going to beat this. That means she had a positive attitude, and she said, I don't care what the other people say, I'm going to beat this. And that was it. She beat the odds. She survived 3 years with brain cancer. She recovered fully from her stroke. She played golf again, but unfortunately, every good story comes to an end. She started smoking again and had a heart attack and died of a heart attack, not from cancer.
Oh, wow.
And the positive attitude is not just for the patient and the families, but for the doctor as well, because sometimes some doctors will say you're diagnosed with cancer and you have to accept it and there's nothing we can do, and they seem to bring the patient and the family down.
Absolutely. And that's where, you know, our bedside training has to be good, and that's lacking. If you spend time, see, the doctor has to be a good listener too, not just a talker. At least in our facility, my colleague and I spend a lot of time with patients, listen to patients, because that in itself is therapeutic. The patient feels confident that the doctor is listening to them, and you know, that's half the battle won. So you're absolutely right. The doctor has to have a good attitude, not a pessimistic attitude. And there are several doctors who will say, oh, get your things in order, you're going to die in 2 months or 3 months, and they play God, and that's wrong.
You know, real quick story about my own mom. She had a condition, and the doctors suspected it was cancer behind her liver. That's the way it was told to me. And it was causing her to get gallstones in the duct between the pancreas and the liver. I don't know if I'm saying that right. So to prevent her from getting, what's it called when you get yellow skin again?
Jaundice.
Yeah. They put a stent in there, but eventually... I should make the story short. She chose, because she had breast cancer that she survived for like 20 years, and she went through all of that. She'd never wanted to go through the whole procedure again. She was 86.
Yes.
And she decided, you know what, if you tell me I have cancer, I don't want anything, I'm just going to let it take me. Which was kind of sad to watch at the end, because she had so much pain at the end of her life. The last month especially. And I mean, what is your thought on that decision, if the quality of life versus
quantity?
I guess versus that last stage when it's really painful.
Well, when we talk about quality of life, which is something that most people don't talk about, you see, as patients, as human beings, we all want to be cured. It's black or white.
Yeah.
Am I going to be cured or am I not going to be cured? That's important if it's possible, but it's not always possible, depending on the stage of the disease, at presentation, and what have you. But then again, you raised an important question about quality of life. Pain destroys your quality of life.
Yeah.
It makes it miserable, you know, to live with pain. And therefore, if I can do something, and radiation is generally used if it's a localized area, to improve the quality of life. And I tell the patients, honestly, that I can't cure you because you're in stage 4 or whatever, but, because when they ask me a pointed question, but I say I can improve your quality of life, and who knows, if you have a positive attitude, you may beat it yourself.
Yeah.
So the whole idea is to reduce the pain, keep them on their feet, and keep them as normal as possible.
And quit smoking.
Yeah.
Obviously, they have to help too, yes.
You are such a strong person, doctor. You have to be strong for your patients and your families and continue this positive outlook. Who are your cheerleaders? How do you keep yourself upbeat? Because you have to deal with this every day.
Well, it comes, you talked about doctors and doctors, some being positive, some being negative from the word go. It also comes from your upbringing, I think, and your personality, how it is formed and what have you. My father always, who was also a physician, he was the dean of the medical school back home in India, and he served the last 30 years of his life helping the poor people. And he used to say, it's not enough if you say you're successful in your career, you've got to give back what you've taken from society. If you've not given back, you haven't lived.
Oh, wow.
And that's always stayed with me. And, I went into this field mainly as, because it was considered a caring specialty. I didn't go in for the money. Today, unfortunately, most people go into medicine to make money, but will never make good doctors, unfortunately.
Oh, well, you're awesome, doctor. I think we are lucky to have you in our community. I think sometimes Ocala is looked upon as a small town and therefore doesn't have much in the form of resources, especially medical resources, but obviously we do. The Florida Regional Cancer Center is not only here, but also, do you have an office in Beverly Hills? Is that right?
That's correct.
Wow, what a great conversation. I know we're out of time. Can you give us some information so we would maybe be able to get in touch with you or with the Florida Regional Cancer Centers?
Sure. Like you said, we have two cancer centers here in Ocala. We have one. We are located at 3201 Southwest Road. 33rd.
33rd Road, okay.
33rd Road. It's called the FRCC, or Florida Regional Cancer Centers. It's on the main road just behind the Paddock Mall. It's easy to get to. And if any of your listeners would like to get, a second opinion or whatever, because most of the time, their doctors haven't told them enough, I'll be happy to help them.
Okay.
And in Beverly Hills, it's 3406 North Lecanto Highway.
Okay.
Beverly Hills 34465.
And just for the listeners, Robin actually put that information on the website for the WOCA.com website. If you go to today's date on the guest list for this show, AM Ocala Live, you'll see at 11 o'clock Dr. Jayanth G. Rao's name, and all of the contact and address information is there to make it easy. Or if you prefer, just call us. We'll be glad to repeat it for you over the phone. Doctor, I really, really appreciate the conversation. When the clock went too quick, but thank you for being on the air with us today.
It was my pleasure. Thank you very much, Larry.
All right, we'll take a little break and be right back.
Habitat for Humanity of Marion County is a ministry dedicated to improving lives by providing affordable and decent housing. Help them help others by visiting the Habitat for Humanity Ocala home store on Northwest 27th Avenue. To schedule a donation, give them a call and they'll come and pick it up. For more information, visit HabitatOcala.org. Habitat for Humanity of Marion County, building homes, building hope, building community.
Hello, this is Dr. Riyad Fakuri, chiropractic orthopedist at the Fakuri Medical and Chiropractic Center. Listen in to the Head to Toe Care Show every Wednesday, 11 a.m.